Hello everyone, my name is Zahra Fatima Khair. Our seminar today is about the disease of the TMJ. TMJ is the joint that hangs the lower jaw mandible to the temporal bone of the skull. It's one of the most frequently used joints in the entire body, moving whenever a person eats, drinks, or talks. As we see here in this picture, the TMJ is the joint that hangs the mandible to the temporal bone. The anatomy of the TMJ. The TMJ consists of the following: glenoid fossa of the temporal bone. The glenoid fossa, as we see here in this picture, it's a depression on the temporal bone posterior to the auricular eminence. Its depth differ from person to person, covered with a hard layer of bone. The second thing is the disc. The disc is consisted of special stroma tissue, has a good blood supply in children to read out in adults. This reduces its ability to react to irritation and to trauma. Also, the disc its upper surface is convex, especially at its crest, to concave at the articular eminence. The inferior surface of the disc is adapted to the bony surface of the condyle. It's less concave in the posterior part comparing with its superior part, to convex at its anterior part. The other part is the condyle. The condylar process consists of two parts, head and neck. It's oval in shape. The long axis is the transverse one. Its posterior articulating surface is broad comparing with the anterior one. At its lateral end, a small process where the external pterygoid ligament is attached. The another part is the ligament. TMJ is the most flexible movable joint in the human body. For this, it's supported by ligament to coordinate these movements. Any distortion in these ligaments will end with the TMJ dysfunction. As we see here in this picture, the TMJ, the mandible, the disc and the condyle. Another in this picture, the detailed anatomy and the detailed picture of the TMJ, head of the mandible and the articular disc. This is the lateral pterygoid muscles. Another picture showing the disc, temporal bone, the muscles, and the TMJ. As we see here, the TMJ, any dysfunction or disorder in this joint, its effect will radiating to the other parts of the head, like the forehead, the eye, the mandible, the neck, and the muscles of the neck. The function of the temporal mandibular joint. As we see here in this picture, in normal function, when the mandible is closed, the disc is in its correct position. It's over the head of the mandible, the coronoid process, in its right position. And then another picture, when the mouth is opened, we see here and the disc is in its normal position. And the third picture, an abnormal function, when the TMJ is opened, when the mandible jaw is opened, the articular disc is retracted anterior to the condylar process. It's abnormal. Symptoms of the TMJ disorders. As we said before, any disorder in the temporal mandibular joint, its effect will radiate to the other parts of the head. As we see here, to the head, it will cause headaches and dizziness in the jaw, locked jaw, difficulty chewing, decreased range of motion, pain when chewing, general jaw pain, or swellings. To the ears, radiating pain, earaches, hearing problems, tinnitus. To the mouth, popping, clicking, and grating. To the neck, it will cause pain and discomfort. As we see here, the normal function of the TMJ, the articular disc, as we see here, it's not a normal position. When they open the jaw, the articular disc will extend anteriorly with the clicking, and it will back to its normal position when you close the mouth. And the clicking, the position of the articular disc, it's correct. With the locking, articular disc is normal position مالته حيتغير. open articular disc will be in the anterior position, and when the patient close the mouth, it will retracted in its anterior position and can get back to its normal position. The clicking sounds, some people with the TMD hear a clicking sounds coming from the TMJ when opening or closing the mouth. This is usually caused by a shifting of the disc inside the joint. The first disorder we have is the disc displacement with reduction. In disc displacement with reduction, the articular disc has displaced anterior to the condylar head. It may also displaced medially and laterally. The disc remains in this position as long as the mouth is closed. When the mouth is opened, the disc is resituated on the condylar head. Because the disc reduces during condylar translation, range of motion is unlimited. Also, the movement may not be as smooth as with normal TMJ. Disc displacement with reduction with intermittent locking. This condition is identical to disc displacement with reduction, with this additional feature of intermittent limited mandibular opening on the occasions that the disc doesn't reduce. Here staging of internal derangement of the TMJ. As we see, when the mouth is open, the articular disc is displaced from its normal position and seated anteriorly, and it can't get back to its normal position when the mouth is closed. As we see here, the articular disc retracted anteriorly from its normal position. Disc displacement without reduction. This occurs when the articular disc doesn't reduce. It may be with limited mouth opening or without limited mouth opening. With limited mouth opening defined as less than 40 mm between maxillary and mandibular incisal edge. Another type, without limited mouth opening. The mandibular movement is unlimited. As we see here in this picture, TMJ in normal opening position, disc stays in a place when jaw is in use. Disc remains in its normal place. TMJ with abnormal disc is pulled frontal when the jaw is in use, causing the bone structures to grind together. As we see here in this picture, the normal position disc in the first picture with the enclosed jaw and when open the jaw. Disc displacement with jaw clicking without reduction. Sorry, with reduction in the second picture. And the last one is the disc displacement with jaw locking without reduction.